Good afternoon, ladies and gentlemen. My name is Dr. Muhammad Rekananda Putra. I represent my colleagues Dr. Thung Sen, Dr. Pavita Musi Sartika Utauruk, Dr. Salsabila Bilkis Maulida, Dr. Areska Ramadan, and our supervisor, Dr. Agus Sugiharto Mars. Thank you for the opportunity today. I would like to present our study scrutinizing the knowledge and stigma of HIV/AIDS in the community level in Indonesia and the correlation to risk groups aversion to screening. In 2018, Indonesia has 640,000 people living with HIV/AIDS, with predicted 49% cases remains unknown. Indonesia has a very strong religious values, which translates to the resolute negative view of these groups, and this manifests as stigma and discrimination towards people living with HIV. It is imperative to review progress that is made through the relentless HIV education effort in Indonesia, so our study aimed at understanding the current community knowledge level in Jakarta, and correlating 3 different stigma domains toward the level of knowledge. We also aim to understand from key HIV population the primary barrier they face in accessing health service. We conducted cross-sectional study in December 2019 at Puskesmas Kebayoran using validated survey instrument and enrolling 83 participants and in-depth interview with respondents representing HIV risk groups and healthcare workers from voluntary counseling and testing or polyphysicity in Puskesmas. After the participants were briefed regarding the study protocol and aim, we acquired written informed consent, and after the data collection, we analyzed using SPSS 26.0. Qualitative data were transcribed verbatim. The data were initially screened for errors and missing inputs, then they were inductively transformed through descriptive and in vivo coding based on the interviewee's language. We found that there is a correlation between HIV knowledge and instrumental stigma towards people living with HIV/AIDS, with the result 0.246 with odds ratio 0.292 and p-value 0.027. Symbolic stigma, which represent beliefs, moral, and norms, had no statistically significant relationship with HIV knowledge, and similarly civility stigma, which represents social justice or punishments against people living with HIV/AIDS, had no statistically significant relationship with HIV knowledge. These findings suggest our community still maintains several beliefs, such as people living with HIV/AIDS are immoral humans, should be confined within their own community, and their disease is a punishment for their own wrongdoing. Through in vivo coding, we were able to analyze 2 main factors and accordingly term them as internal and external factors in line with the nature of subfactors within each categories. A greater proportion denoted denial and fear of HIV stigma with an internal factor as a barrier for accessing HIV testing, for instance, as a respondent from the male sex with male population. The result of this study is consistent with prior evidence showing the poor knowledge of HIV among the general public in Indonesia, and even more concerning amidst the healthcare provider. Several cited contributing factors are stigmatization, prejudice and bias, lack of willingness to learn, and dismissive attitudes. Correlation with religious affiliation had also been shown previously. Here we demonstrated that this lack in knowledge is moderate to strongly correlated with high stigma in general and the high persistence of the 3 stigma facets among Jakartans. We also indicated qualitative evidence among key population that stigmatization is one of the leading barriers in accessing HIV/AIDS care. I would like to close with the knowledge on HIV/AIDS is still low at the community level in the capital city of Indonesia, Jakarta, which correlates to higher stigma and contributes as a central obstacle for high-risk population to accessing HIV/AIDS medical